you have to be able to go out to an engineer and attract people at the top of the craft by allowing them to feel that they're going to join an organization that appreciates that craft. And there's a way of thinking, there's a way of communicating, all of that is very, very important. There's cultural elements. And I think Google left me on really strong foundations there. Same is true on the medical side.
Hello, everyone, and welcome to the Health Technology Podcast. My name is Christine Winotto, and I'm the director of the UCSF Rosamond Institute at the University of California, San Francisco. Today, we have Sean Duffy in the studio. Sean is the CEO and co-founder of Omada Health. Omada Health is a digital health company that serves patients living with or at risk of chronic diseases, primarily diabetes. Omada Health partners with large commercial companies such as Lowe's Hardware who face healthcare challenges in their employee pool that arise from a combination of genetics and lifestyle. So Sean started at Google and IDEO before he co-founded Omada Health. And what you might find particularly interesting is his story of how Omada Health innovated its business model around the constraints of the U.S. healthcare system, and how that business model incorporates incentive for all the stakeholders, including the patients. And before we hear from Sean, I want to let you know that we will be taking a break from our health technology podcast for the holiday seasons, but we'll be back in the beginning of the year. So tune in to our amazing lineup of guests for 2020 and have a very happy holiday. And don't forget to subscribe to our podcast on iTunes. Welcome, Sean. Thanks for joining me today. And I thought it would be really a good start for the listener to know more about what does Omada Health do.
Sure, happy to. Yeah, thank you so much for having me on the podcast. So Omada Health, I founded the company in 2011, and the best way to think of us is actually as a digital provider. Right, so we're right here at UCSF. Imagine a world where 10 to 20 years from now, some of the biggest providers across the country are digital. The areas that we serve patients are, in large part, the metabolic category, so prediabetes, type 2 hypertension. But we're interested in providing care at scale for the condition areas where about 80 or so % of the care to be done can be done safely, effectively, digitally. Mm-hmm. And then we'll build partnerships to bridge the remaining 20. So that's kind of the journey that we're on as a business, again, starting in large part the diabetes space.
So do you collaborate with the provider, or you just mostly tailoring to the patient?
So that's, the collaboration with the provider are starting in a neat way for the business now, where I think that services like Omada can be an amazing extension for primary care clinicians. Mm-hmm. One of the things that I think is ever present right now is the fact that type 2 diabetes really has become a disease that's supported at the primary care level. And it's a disease that requires a lot of different touch points over a long period of time. It's an intersection between biology, behavior, there's a whole lot of medication classes. And the idea that an Omada can serve as an extension to a primary care doc, almost as a specialty clinic in those spaces, I think is a compelling vision and mission. And it's one that we've been bit by bit, year over year since when we founded the company marching toward.
Mm-hmm. Okay. So maybe you can segue a bit, before you start Omada Health, because you have a really interesting background. You had a neuroscience degree, mm-hmm. Yep. And then you end up working at Google, and then you work at IDEO, and then you went to business school and medical school and decided to stop that and then go to start Omada Health. But even with the history, you do a lot of in the wellness mm-hmm, stuff. So, yep. What drive you there and how to get there?
No, for sure. So, I would say, so I grew up in Colorado. Always loved technology. Loved messing around with computers. It's kind of like, in high school, I think I wore sweatpants through sophomore year until my sister was like, "No, Sean, you need jeans. You're never gonna go on a date." So I loved technology. I loved computers. It felt like a neat thing to give back to the world by entering healthcare. So I was kind of interested in that. But so I ended up studying neuroscience in undergrad. Graduated in 2006. It was this amazing time in Silicon Valley history. I think when you're an undergrad, you tend to think the worlds are binary. You have to pick either tech or healthcare. And I had done my pre-medical requirements, got a little bit of cold feet, just applying straight to med school. So I ended up seeing this random job opportunity at Google. I worked at Google for a couple of years, quickly realized that, the world has more shades of gray from a career standpoint. Had the ambition to do something in tech meets healthcare and applied to medical school. So I enrolled in Harvard, has an MD MBA program. As you progress through that program, they ask that you take an internship that's a mix of business and medicine. And from my time in the Valley, I'd known people at IDEO. So came out to IDEO, became fast friends with this gentleman, Adrian James, who is Omada's co-founder from IDEO. And we were given a little bit of time and budget from one of the early leaders at IDEO to explore areas of business opportunity in digital health, really under the guise of the reality that the tech worlds and the clinical worlds back then were very far apart. And it felt like the world needed a more evidence-based digital health company in areas where digital could clearly make a difference and you could prove that it could make a difference. And really under the conceit that at the end of the day, you could build a business to capture the value of improving outcomes in health through kind of a combination of tech, people, the works. And that kind of became the charter for Omada. And we got very, very interested in obesity-related chronic disease because it's one of those intractable challenges for the country that all the evidence shows to make progress, you have to really help support people on a day-to-day, week-by-week basis. And the current U.S. healthcare system is just not suited to do it. So it clearly was not going to happen unless digital came in to do it.
So I noticed that before Omada, you also start another company that is doing a digital and a lifestyle business.
That's funny. So that was the company referencing. I call it a lifestyle business because it just kind of sits on the side. It's a kind of neat Excel training tool, and it's something that I built to teach others how to use Excel. And I like making things, and it became and it's still to this day. It's like a little playground.
Okay, so it's more like something that you do it on the side for like a hobby.
Exactly. Yeah. It's
okay.
And actually, for entrepreneurs, if there's any entrepreneurs listening, I think the quickest way to learn the most about entrepreneurship is to find something small where you don't, you're kind of okay if it fails, like your whole career is not riding on it, and treat it like a little side hobby, almost like a modern lemonade stand.
Yeah.
And just give it a go. Try to build something that delivers value to consumers, where you get some revenue coming in, you're going to learn about marketing, all the kind of key aspects to building a business in a little kind of microcosm.
Yeah.
It's kind of a great way to cut your teeth in entrepreneurship.
I figure you did that before you decided to go to business school, or is that something?
Yeah, I started. So I started that one in med school.
Okay. Well, you're busy with other things too.
I don't watch much TV. Let's put it that way.
That's good.
Don't quiz me on Game of Thrones references. I won't be able to answer thoughtfully. But I like on the side I like just building things. So it's going to be either that or it's Legos or RC cars or something building anything I have fun with. So.
Okay, it's so do you? That seems like something that is in you that somehow maybe your upbringing kind of nurture you to be that, or just something that you think it's nurture versus something that's.
Well, I don't know. I think it's probably a combination. I do think what I appreciate about and kind of when you're going through the experience, you almost take it for granted. But what I appreciate about my childhood is any imagined world suddenly became real. My mom was always oh, we want to imagine a full-on campground in our basement, we're gonna make it, or
you must have a really fun mom.
All these games or whatever. My mom and I used to go do a skit at elementary schools where we would teach elementary kids about pioneer medicine, and I was this little performance that we did together where she would stick a fake leech in my mouth and all this, and I thought it was totally normal. Just a normal experience of a kid growing up, and it was I don't know, so it was very playful, which I don't know. I think honestly left me with a feeling that I still feel this day, where I like to, if I imagine something, I find that.
How do I make it happen?
Well, yeah, no, it's almost becomes a compulsion because it feels like it should be able to exist. So you just keep trying all the different angles. And rolling with the punches and going through the zigzags, and then like weirdly it exists. It like starts to exist.
Yeah. So does any of your siblings kind of have that similar mindset, or just you?
Well, my older sister, she's like an engineer meets a business person, like less right now, kind of in the entrepreneurship world, but like thinking a ton about kind of new business creation.
There's a lot of
very, very creative individual too. So.
Okay, well, that sounds like you have a fun childhood growing up. That you do a lot of fun things.
Yeah, no,
so
sure.
Looking back when you do the neuroscience and working in Google, how is that experience help you to make the decision to? I mean, I'm just thinking some people just know along, and how. I'm sure that you can connect the dot now to see how that can help you to be where you are.
For sure. I think like what I appreciated. There's so many things I appreciated about Google. I think what you appreciate the most is that there are some org things, like the power of just amazing people, like working to literally do anything to hire the best possible people you can bring in. Google was really good at that. Like they would really recognize talent. But just the power of like software engineering, like design, user experience, there's almost like a palette of fundamental appreciation for the art of engineering and of software and how that can scale. That becomes helpful to guide a strategy in what we do. And it's some of it's kind of like silly and small and tactical, but it's like it's important for a CEO of a company like Omada that's trying to bring a world together that could potentially converge to make it happen. And you have to be able to go out to an engineer and attract people at the top of the craft by allowing them to feel that they're going to join an organization that appreciates that craft. And there's a way of thinking, there's a way of communicating, all of that is very, very important. There's cultural elements. And I think Google left me on really strong foundations there. Same is true on the medical side. There's, I didn't end up finishing med school because I started it well and, started Omada well in medical school. But there's a way to think about, literature, a trial, what the guidelines say, like what the actual life of a clinician is, like what really happens at a hospital, like what, the realities of care, art, science, like the, ROC curves. I mean, you name it. There's like a vernacular, a culture, like a craft and an appreciation. And it's overly simplistic, but I always think my job number one is to make sure that we as an org can pull in talent from both sides and provide a culture where both can appreciate each other's skill sets. And I do think that if I got anything from Google, it was kind of the tech side, and then medical school was like how I helped think about how the worlds could blend.
And so it looks like also at the same time that the fact that you met with your co-founder from IDEO is also another serendipity. But then you took that opportunity when you see it to, go with it, right?
Yeah, it's funny because it's so like, it really actually, weird. I don't even know how to feel about it, to be honest, today, because it's like, I stand up at my Monday morning meetings and we've got like hundreds of employees now. And I'm like, wow, it scares me a little bit. So I'm just like, what do we need to do like next quarter, like next year? Like what's our, I'm just like, let's get to the work. Because the whole thing still feels like this weird accident. Like it's one of those, you never know what life like brings you.
Right.
Like this weird random door opened. I got excited by it. I loved working with Adrian. Like I loved the problem felt like it was of the sort that someone needed to swing at it.
Yeah.
And it just like felt like we got, almost felt like we had to do it. But yeah, it was a weird accident, which honestly a lot of innovation is. Like, it's a mix of like a predisposition to be hunting and scouting for opportunities, and kind of the want of like wanting to create something new for the world, and like seeing a weird door where like, I think that's it. And then just walking through it.
Yeah, and then along the way, you meet the right people.
Yeah, you just meet the right people. I know, it's like amazing. And that's what's so beautiful about life. And honestly, like the Bay Area too, because it's such a neat blend of, life sciences, technology. Like there's very few places where there's such potential for interesting accidental interactions that can turn into value for the world.
Yeah, so one of the things that I was very impressed when I learned about Omada first a few years ago is that, there's a lot of digital space. Like a lot of people want to do digital healthcare, but then not many people figured out their business model yet. And I thought you guys did really well. And one of the first in approaching it that way. And if you can walk us through how you end up going there and comparing when you first started, did you ever thought that that is the route when you first started?
Oh well, it's funny. So I was love it or honestly, it's probably more of a blessing. But like when I founded the business, I didn't know anything about the how a dollar flowed through the U.S. healthcare system. So it was one of those things where there was a huge learning curve to even understand the different stakeholders, what their values are, what their motivations would be, like how you could commercialize something. Because first principles, what we were trying to do at Omada and remain is commercialize an outcome, right? And the long journey of medical innovation tends to be that, right? Whether it's a device, right, that helps a practitioner get to a better outcome, or itself maybe furthers an outcome, whether it's a therapeutic, right, that like gets to an outcome, and you try to like almost like sell the value of the outcome. It's the product. So it's like, well, okay, let's try to like commercialize the outcome of this like mix of like digital coaching, like combinations, like content, like so. We didn't kind of know how to do it, but I stuck to first principles of like we should probably publish, right, and generate some evidence to show that like in the setting of in a peer reviewed setting, like people say, okay, well, Omada's getting outcomes. And we should probably figure out how to like fit into the system versus try to go around it. Because you start to really take a pulse check on the U.S. healthcare system, and a pragmatic person quickly recognizes the fact that there are actually irrational laws of physics of the healthcare system that you get annoyed by them, but you can't change them. There's just some immutable truth. So for us, the way we started to do it is like, all right, well, let's publish, let's show that we can generate the outcome, and let's figure out how to fit in, and we actually figure out how to contract as a digital provider. Mm-hmm. We brought our trials to the AMA. We got issued actually the first ever digital specific CPT code. It's like a Cat3 code, it's a tracking code, but it totally works. So we lock in as a provider, as a covered entity, we figure out how to file claims on that code in kind of a really unique value-based way with our payer partners, and like kind of learned how to do it. And now, but that's existing infrastructure, and a bit of it is always like painting a future vision for your partners on how to adopt what you do. Because I do think that health plans, 3 or 4 years out from now, will actually have contracting groups that set up in-network relationships with in-person providers, and they'll have network teams that set up digital networks. And we're not there yet. So like we had to just kind of jury rig it. And the most common way I describe it is that scene on Apollo 13, where you've got like the square CO2 cartridge, and you have to build piping to fit it into the round like socket. And like you have to use only the parts on the ship before the oxygen goes away. And as an entrepreneur, the oxygen is like your bank account, right? So you're like, you guys got to figure out how to do it. So it was, and it's something I'm very proud of about Omada. Like because I don't, like, it has to be done. Otherwise the business won't thrive.
Right.
And,
but then you have to convince other people.
Yeah, exactly.
To do that for the CPT code. Like how do you convince them that there's an economic value for them?
Oh, exactly. Yeah. It's all of that. It's like, so you're at Omada, like for the vernacular we tend to use is operational innovation. And where I think is proud of that is technological, simply because that's almost like the translational side of what we do. Like technology means nothing. Like you're not going to have any impact on the world unless you figure out how to actually like deliver it inside the constraints of the U.S. healthcare system.
Right. And so when because that's pretty novel approach at that time. And I think a lot of people now learn from Omada. And so I'm just thinking, if you can walk back to when you first have that vision and you have to sell that vision to investors and nothing has been proven. How do you get there to get your first investors?
Well,
and how many doors did you knock?
Well, a lot. I mean, like I just remember, I mean, our like, oh my gosh, I looked at our seed presentation for our seed financing. Like, I don't know how people invest in this. Like, what are they thinking? Like, this is crazy. But I think, I think honestly, some of the best seed investors, they're just betting on a person, right? They're just like, the deck or whatever. Like, you're kind of betting on a problem and a team at that point. And that's how you win. You have good instincts. And they appreciate it. Maybe they were just betting on me, but like we didn't know how we were going to commercialize. Nothing had been done like this. What I found early on was there were life science investors would come in, and they're like, well, where's your monopolistic IP? Like, like why? Of course, like United or life sciences companies could just make this. Like, you're not, software's so easy, right? And then on the but they're like, so that's not us. On the tech side, you'd get very early on, oh well, this actually sounds great, but like, you have to publish clinical trials. Like, why is that going to take 2 years? Like, why would you fund that money to do that? Like, so there were fewer investors at the intersection. Now there's more. So it's a better time now to be thinking about convergence ideas. Back then, it was just literally finding the believers. And I found the earlier investors, like the gentleman who led our Series A, Dr. John Root at US Venture Partners, like does like a lot of therapeutics investing. He still has devices, like, but he has an appreciation for software and just kind of a belief that first principles would ring true if we could get an outcome and commercialize it. And so, I don't know. You just need The beautiful thing about raising financing is you need one firm and person. Right. Catalyze the whole round. So it's like, you don't need consensus. By definition, like, you're not going to find it because otherwise it would have already been done. Right. Like the idea would have already been created. So,
do you think at that moment John Root has the premonition that there will be a business model coming up from this?
Yeah, I think so. I think he was willing to sign up for like the journey of figuring it out together. Right. So, and then in some previous kind of investments and experience, he'd seen kind of the intersections between employers and payers and like, some takes at various go-to-markets that I think left him convinced.
Finding somebody who has done many different aspects of things that kind of is not quite the same, but then they have gone through the journey help.
Exactly, yeah. And I found back then that the firms that were most interested were the firms that happened to, they happened to have GPs that would do both healthcare deals and tech deals. Because, inevitably these partners are at Monday morning meetings and they see a little bit of both.
Right, so you bring them together.
Exactly. So the trickiest ones were like tech only, but maybe they will dabble in healthcare, or life sciences only, and then, maybe I'll dabble in tech.
Right. This way they can convince each other.
They can convince each other. Exactly.
Yeah. Okay. And so at what moment then you just like, aha, this is how we should do our business model?
Well, I think that in terms of contracting as a provider and filing claims, once we started really working with self-insured employers and hearing what life is like for them and trying to do that in a way that listens to, frankly, like the strategy and the operational side as much as anything. What we realized is we have to fit in. Like, if you're, let's say you're Acme Inc. and you're self-insured and you're 10,000 employees, your annual medical expenditures as a self-insured employer of that size are probably about $100 million, off your balance sheet. So, your employees walk into the doctor's office, they pull out their Aetna card, but Aetna's just running the claims and setting up the network. And that's the value you're buying. But your personal budget for solutions on top, or like other things you might want to do, or wellness programs, that's a couple million. And you're not staffed to try to take on a ton of new vendors. So it was clear that like we needed to find a way to not require that these employers had to contract with Omada. And the way for us was, okay, well, we'll just make sure we have enough clinical data that we can earn the right through interactions with the plan to be a provider. And then we can work with the employer to tell their employees about Omada, but when we enroll them, we're filing claims just like any other provider through the plan. Because then the employer doesn't have to do a direct contract, and it kind of makes the sales friction decrease. So that I think was a key aha. Now that's easy to say, hard to do. But it was clear that was like the right strategy to promulgate Omada's business in the absence of what a traditional like healthcare strategy would be, which is, you build your thing that delivers an outcome. You get the regulatory approvals, you publish the outcomes, you get the KOLs on board, you show demand, and then you have your sales team call on healthcare practitioners to recommend it to patients. Like, no way in the world I could have convinced any investor that like, okay, great, just trust us. Like, we're gonna put $100 million into the business, and 8 years later, like we'll hire a 100% primary care sales force. So it was like that wouldn't have worked. So
right.
this kind of did.
Yeah. No, it's so. I mean, maybe for some of the listeners who don't quite know Omada Health business model, I think we skipped that. Maybe
sure,
if you can
of course.
tell us.
Yeah. So again, we contract as a provider. When people enroll into the program, we file claims, we kind of bill as such. The business model is we charge. It's a little bit different depending on condition area, but large part the way to think of it is we charge according to enrollment and outcomes, and if people are engaging in the program as well. So it's like when someone signs up, we file a claim through the system. Omada gets paid, and then as someone loses weight, we continue to file claims, and then if people aren't utilizing our services, we cease billing. So it's kind of like a neat claims-based billing model, and that's been attractive to the employer and plans because they know that if they're paying for something, it's for the value that we up front aligned was there. And if it's a particularly difficult population, that's kind of on us. Like, so it's it's kind of like charging on real world outcomes, which is a bit unusual. But the key fundamentals to the business model are that, and also perhaps even more importantly, the fact that we've been able to find ways to fit it in, and file claims and not going to break or try to rewrite billing infrastructure.
So, in order to continue keeping your customer happy, the employer in this case, like what kind of data that they want to see?
Yeah, well, so the employers always want it appropriately, and this is how we would only provide it, but the data in aggregate, right? So,
right.
They're like, well, how, at a broad level, are my employees engaging? Are they using it? What their success look like? We have found that different employers, care about different things. But what's very, very clear is if you're a benefits leader, you're used to rolling out things that are going to upset some apple carts. Like even if it's a benefits plan that's better and richer, there's going to be a subset of employees that change impacts them very emotionally and very negatively. So one of the things that started to happen is this became a benefit that in every single account we've rolled out, like people are really appreciative. Like they're like writing thank you notes to their HR leaders. And so I found that in addition to reviewing like the aggregate data, like the employers are loving the stories that, like my employee said this.
Happier.
And like, so there's like a cultural value, which we don't lead with in selling. We lead with, the clinical and economic rationale. But there's a huge cultural value. And,
it shows that the employer cares about.
The employer cares, exactly, which is kind of a great thing. So we have, we now have over 600 employers and growing quickly, and just exceptionally low churn. In fact, we have some health plans that are, they're contracting with Omada or have contracted with Omada because new employers that they'd signed up said, I won't work with you unless you have the Omada solution.
That's kind of nice. You should pay them commission.
So you get this virtuous cycles, which is one of the things I love most about what we do because, you don't, at the clinician level, if you don't come back and give your doctor a hug for that statin, right?
Right.
It's like, oh my gosh, thanks for like a statin. Doc.
Only if you save their lives.
Yeah, right. So, but this people feel a deep sense of appreciation, which I think shows what a void we've been putting people in the healthcare system. Like the idea that before Omada, people felt like utterly alone. They'd get type 2 and they're off in the ether, or like they find out they're borderline diabetic and have prediabetes. It's like, okay, go lose weight on your own.
Right.
Like, that feels really good to drop.
And the other thing that you also have is to create a community for the participants.
Exactly. Yeah, you're not alone. You've got a coach, there's a group of others, there's timelines, there's goal architecture, there's like week by week content. You can have a very immersive, like high tech but high touch experience.
Right. This podcast is sponsored by IO Life Science, a Silicon Valley-based medtech design and development consultancy, transforming your technologies into a unique healthcare solution. For more information, visit their website at iolifescience.com. This podcast is also sponsored by Brown Ratnick's Global Life Sciences Group, a team of legal professionals that helps life science companies, lenders, and investors around the world turn good science into good business. Learn more at brownratnick.com. So when you started Omada, I'm sure it was not as rich offering as it is today. I hope.
Correct, yeah.
Because
Correct.
I always tell people, it's not like you were born one day, you become an adult.
Oh, for sure, yeah.
And so how do you where do you get the feedback? How do you decide on what are the next offering that you add on?
Yeah. So I mean, we're, now what's neat is we're able to do things that, you almost always dream about in the early days, but you couldn't do. I mean, I was our first health coach. Adrian, my co-founder, was our second. It's like there's this, it's kind of fun to see the business evolve to a level of maturity. And I think that in terms of how we think about how to best maximize our value, other conditions, other areas, I always start first with the clinical realities. So it doesn't matter if somebody wants something from Omada, can you actually do it, right? Can you safely deliver an outcome at scale, right? That, through an internet connection. And then if the answer is yes, then it's okay, well, great. Is there customer demand? Is this something that with our channels and with our partners that we feel we could commercialize? So those are kind of the two kind of primary, and working to make sure we stay focused so that though we're expanding wider, we're making sure to stay in a world where we can continue to go deep and remain excellent. So it's it's always a little bit of a balancing act. I don't want to be the company that's oh, you want that? Here, look what I found here.
Yeah.
You know what I mean? It needs to be very, especially when you're dealing with health, very thoughtful and reasoned.
Right. And so now you have how many that you covered? You have the
prediabetes, type 2, hypertension, and mental health.
And mental health. That's the reason one. I don't.
Mental health is recent, and the primary rationale for it is actually to make sure that can be an intel inside in every condition area, right? Because if you have type 2, and one of the key headwinds you're facing in being able to do what's needed to optimize your health and prevent progression, if the primary headwind is depression, you have to focus on that. You can't pretend that doesn't exist, or you can't, so it's core enough, and there's such a tight comorbidity, and the costs of someone with type 2 and depression are 3x, right? So the key rationale there is intel, almost like an intel inside, and I think that's how healthcare should have been done. It's absurd that we have completely different worlds of behavioral and medical, as if there's not an intersection there.
Yeah, I think it's more historical.
Yeah, it's more historical, and I'm well, we're starting this thing from scratch. We can do what we want here. Right. So that one's kind of exciting new addition, evaluating a couple of others.
How do you compare yourself, with a company who's just focusing on a mental health? Because that you have the advantage of having that participant in other disease area also, but compared to somebody who's just we're just going to focus on mental health.
Well, I think there's such a big world. In all these condition areas that. Similar to therapeutics, there's so many different classes of mental health medicines, right? So there's many different approaches that can work, and I think a standalone offering is going to be and will be a market expectation. Omada, will meet that need. Yet there's so much clinical power in the integrations, and that's kind of the really difficult kind of nuanced thing. So I think that the standalone companies in mental health are delivering something very valuable. And I love that there's so many different approaches, because I think that's needed, especially in that condition area.
Yeah. So I'm going to ask this question that maybe is a bit something that you might not feel like you should answer this question.
Away, yeah.
But you're sitting with a gazillion of data, and now data is power, information is power, and when I look at the Amazon, they're just growing based on getting a lot of the data from the consumer. This is an opportunity for the Omada to also have so much data on your hands.
Well, it is a huge opportunity, and you have to treasure that and make sure that you continue to earn the trust of the world to be blessed with the ability to use that to innovate. So I mean, we are a HIPAA covered entity. So all federal and state data security and privacy practices that a provider that has a waiting room needs to hold to, Omada needs to hold to. And in our license agreements, our participants actually own the data. So Omada, of course, has a license to be able to use it to further our business and make the experience better. But that's the center of the data, and that's where it needs to be. I think not just in our business, but just in the U.S. healthcare system. I mean, me as a person who goes into a clinic, I should have the data. Now, the power, I think, in digital, there's obviously amazing things you can do with like claims data and down the road when there's more interoperability, like EHR data, but like actually the tiniest data has the most powerful impact. And what I mean by that is in a digital experience, you can actually measure every little thing about what the users are doing, which pages they're going to, how long it takes them to read a lesson, when they're stepping on their scale, when they're checking their sugars. You name it. It's so easy to have analytics touching everything that allows you to personalize in really interesting ways. So if you ask yourself, all right, so I'm an in-person provider, and I've got a patient coming in, and they're going to be in the waiting room for I can measure exactly how long they're in the waiting room, how long it takes them to walk from the waiting room to the procedure room, right? On the way, did they see a painting, right? Did they stop and look at it? How long did they look at it? What's on the painting, right? What piques their attention? And then you can use those inputs to change the next hallway they walk down, right? Nobody can do that in person. And in digital, you can rewrite and recreate the experience through data in a very powerful manner that you could just never in person. And so you can optimize for the experience in new ways, to meet the behaviors in new ways, to meet the biology in new ways. And I think therein lies the incredible power of these convergences that are happening right now in the U.S. healthcare system. And that's why I think it's the coolest moment.
Yeah, I'm very excited about it. I think that's really exciting time.
Yeah.
The next 10 years will be
It's crazy. Yeah. The last 10 have been crazy.
Yeah.
The next 10 are going to be even more insane. The pace feels like it's quickening.
It'll go faster, I think. So we're short in time, and I just thought maybe we can conclude. You dropped out from medical school. Do you think one day you'll go back?
Probably not. I do actually. It'd be really fun to there's something that'd be so neat to practice. It's just I think they're the adage of follow your contribution, right? You ask yourself what can you uniquely contribute to create kind of a better world. For me, it's these intersections. So it wouldn't make sense.
You
probably.
got to make an impact, bigger impact probably than you go back to medical school. So maybe you can go back as a hobby.
There we go. Exactly.
So okay,
awesome.
Well, great. Thank you so much.
Yeah, of course. Yeah, thanks for having me on the podcast.
Okay, good.